Hey, it's Dr. Kapoor from MD Live. You're on the recorded line. Can you please tell me your name and date of birth, please?
Omar Fued, 12/14/88.
Thank you so much, Omar. And which state are you located in?
Florida.
Thank you. My name is Dr. Kapoor, and I'm board certified in internal medicine. And I have reviewed your allergies here. I'm looking at it. Give me 1 second. You're allergic to Ativan, Xanax, and Safraris, Haldol, ibuprofen. You are on ondansetron, ibuprofen, and metacarbamol. You have history of schizophrenia, neck injury, shoulder pain, pain in finger of left hand, wrist, foot pain. You do have nerve entrapment, numbness of hand, numbness of palm, back pain, back injury, head injury, and no prior surgeries. Correct, sir?
Yeah, I'm not schizophrenic though.
Okay. It says schizophrenia listed 2024 as your diagnosis.
By who?
Under your profile listed by you.
I told you I was schizophrenic in 2024.
No. I'm reading from the chart you have filled. So is that incorrect? It should be deleted.
Yeah, I tried to delete it, but it wouldn't delete.
It was entered in error. So I'm going to deactivate it, okay?
Okay.
All right. Wonderful. So how can I help you, sir? Tell me what's going on. I'm just looking at some of the images you posted on your account. I see two of the visit summary you have, but really not an image. So tell me what's going on, sir. How can I help you?
There's an abscess under my left eye, and there's an abscess in between my eyebrows.
Left eye and in between the eyebrows. Can you post a picture to the account for that? I don't see any images of that.
Oh, yeah, hold on a second. So my neck is hurting also. I'm trying not to do too much moving around. Oh. Yeah.
You must have received a link on your phone.
Okay.
Let me know when you're done or if you need any help.
Okay. Photo upload. Okay. Upload a photo regarding Your reason for visit. Okay. Okay. It says your photos have been successfully uploaded.
Yes. Let me review that. Give me 1 second. Yes, I see one under your left eyelid and one on in between the bridge of the nose. You're saying?
Yes. It's underneath the skin though, but it's like it's starting to come out. I tried
In
to.
between the eyebrows, the bridge of the nose.
Yes, and I tried to clean it, but I'm noticing it's like it's getting bigger.
Pus coming out.
Yeah.
So you noted yellow pus come out when you squeeze.
Yeah, well, I didn't squeeze it. I tried to like put like a hot rag on it, like a hot towel. And I noticed like the infection it got onto the towel. Similar, like a similar color if I were to squeeze it, but I didn't want to squeeze it because they told me if I squeeze it, it's gonna go deeper into the follicle, or it's gonna go deeper into the pore, and it's gonna get more infected. So they said to try to put like a hot towel on it to try to let the infection um, absorb into the towel instead of trying to squeeze it and pushing it deeper into the pore and only a little bit of the infection coming out. So I try to do that, but it's not working.
I see. And it's painful.
Yeah, and I noticed that it's like it's giving me a sore throat because like when I'm trying to take a shower and I'm washing my face, sometimes like that the infection from the abscess, it's like it goes from the water, it's like dripping into my mouth, and I'm noticing it's hurting my throat also.
I see. So it looks like you'll need course of antibiotic. I'll send you back from antibiotic to pharmacy, and also I'm going to send you a prescription for mupirocin antibiotic ointment, and you can apply 2 to 3 times a day. Apply warm compresses. Follow with your doctor in a couple of days. If you look better, you can always go to the urgent care or ER. Okay?
Okay, and then also I noticed when I'm cleaning myself after I have a bowel movement, I'm noticing it smells like fish in my anal area.
How long has it going on?
The smell of the fish is I've noticed it for several days now, but it hasn't went away.
And has someone looked down if you have a boil around that area?
No, I didn't see any boil or anything. Could you hold on 1 second? Somebody's at my door. Hold on 1 second, please. Oh, ya Rabbi. Oh. Hello?
Hello.
Yes.
So, you don't have any ball in the anal area or anything?
No.
I see. So for that, I would suggest you go to your doctor's office on Monday or Tuesday, get stool testing, get examined. Someone has to see and look whether you have some kind of rash or something, or ingrown hair or something else. Because just on the phone talking is difficult to know what could be contributing to this. So I strongly recommend that you see your doctor in person.
Okay, yeah, I had a I noticed there was also blood in my stool. So I might have a hemorrhoid or something, but the blood in the stool, it goes and it comes. Like, for example, I didn't see any blood in my stool for a few days, and then all of a sudden I saw some blood in my stool. But the fish smell, it's been there for several days, even during those days that I didn't see any blood in my stool. So I don't know if there's like a I forgot. I looked it up on Google. There was a word for it, some kind of like some name.
Do you have active blood discharge like today, like blood poured out of your stool, or you notice like a little bit of blood stain in the stool?
Yeah, I noticed there was like some blood smeared onto the solid piece of feces when it was coming out, as if it was like rubbing against some kind of hemorrhoid or something inside as it was coming out.
I'll strongly recommend that either you go see a doctor tomorrow or you go to urgent care and have someone examine you and look at it. Because for these situations, you might need a colonoscopy or sigmoidoscopy, GI doctor, extensive evaluation, and through telemedicine, we can't really do much for these issues because of the fact that we treat minor illnesses. You need a comprehensive, detailed examination in person via a doctor. So it's very much recommended that you see a doctor in person, okay?
Inshallah. The only problem is they keep sending me unsanitary transportation vehicles to go to and from my doctor's appointments, and then when I go to the emergency room, they harass me. It's an ongoing problem. That's why I've been trying to get help from the Humana MD Live Medicaid option.
Right, but this is for minor illnesses. It's not for something which you are looking for a situation like what you're describing. It requires you to visit a doctor. This is only telemedicine where we treat minor illnesses. You need to have a doctor visit in person for something like this, which requires examination, referral to a GI specialist, and also they need to examine and test for the stool. So all these things can be done only at doctor's office or at the urgent care or emergency room. Okay?
Inshallah. And then another thing too, the back of my neck is hurting, and it's difficult for me to hold my neck up, and it's making it difficult for me to sleep. Also, is there something you could prescribe me for that to help with?
For that, you can Voltaren gel, which is over the counter, and also you can get ibuprofen, 600 milligram, which is 200 milligram, 4 tablets, or 3 tablets. Actually, you're allergic to ibuprofen, so you can only take Tylenol. So take Tylenol, 2 tablets every 8 hours for 2-3 days. What happens when you take ibuprofen?
So it's the specific brand. It's called Reddy's, Dr. Reddy's. It's the ibuprofen that they give to people when they're in prison. It's called Dr. Reddy's.
Okay.
That one gives me an allergic reaction.
What kind?
I started feeling sick.
What?
I noticed when I was laying on the bed in the prison, uh, I couldn't open my eyes and my body started shaking uncontrollably. I felt like I was about to die, and
Uh,
I don't know what kind of allergic reaction that's called, but how it felt.
if you're very sensitive, you can take Tylenol. So Tylenol 2 tablets every 8 hours, and then you can use a gel called Voltaren. You can or you can use any kind of medicated gel called Bangay over the counter for pain relief. If your pain is worse, not getting relief, you can go to urgent care or ER or to your doctor. Okay.
Or is there anything you could prescribe me for the pain?
No, we don't prescribe pain medication via MD Live. Sorry about that, sir.
They prescribed me previously. It was like a muscle relaxer.
But this is not an issue of muscle spasm. This is a pain.
Right.
This is more of a pain issue. So if you have a muscle spasm, that's when you use muscle relaxant. So I don't think so you need a muscle relaxant in this situation. Okay?
Okay, what about something to help me sleep?
We don't prescribe sleep medication either. And just for your information, also, we want to make sure that you see your doctor in person. If you have so many issues going on, you must see a doctor in person. Okay, Mr. O'Brien?
Okay. Thank you, doctor.
All right, I'll send you a prescription right now. You have a wonderful rest of the evening, and thanks for calling MD Live. Bye-bye.
Assalamu alaikum wa rahmatullahi wa barakatuh. Time now is 4:16 p.m. Today is Sunday, November 3rd, 2024. The duration of this audio transcript is 18 minutes and 27 seconds. The duration of the previous audio transcript at 3:14 p.m. was 22 minutes and 21 seconds. Assalamu alaikum wa rahmatullahi wa barakatuh.
Xanax, Patel, ibuprofen, and Abcess.
Say that again?
You are allergic to Ativan, Xanax, Patel, ibuprofen, and Abcess.
Yes. Dr. Patel,
Okay.
what's your first name?
My first name is Rajni, R-A-J-N-I.
Say it again, I'm sorry.
I go slowly. R for Roger, sir. A for Apple. J for John. N for Nancy. I for India. Rajni, R-A-J-N-I.
Okay. Because my previous doctor was Dr. Ramal Patel. I don't know if you know him.
Yeah, Patel is a very common surname, sir.
Mm-hmm.
All right, so now last thing I have to go with you is medication. You taking those nausea medicines?
No.
No. Okay. Are you taking ibuprofen 800 milligram tablets?
No.
No. How about methocarbol 750 milligram tablets? Are you taking that?
No.
No. Are you taking any medicines at present?
No.
No. Okay. All right. And how can I help you, sir, today?
My throat is hurting. I don't feel good. And my neck is hurting.
Sore throat. Okay, let me start slowly. Today is November the 5th, so your throat has been sore since when?
Yesterday.
Since yesterday. On a scale of 1 to 10, how bad is your pain in your throat, sir?
I don't know. It's like it's uncomfortable. I guess like an 8.
8. That's a lot of pain, okay? I will just go from head to toe. So do you have any headache, sir?
I had a headache a couple days ago, but it went away. But now I just have a sore throat. And
so no headache now, okay?
Yep.
Do you have any nasal or sinus congestion?
Yes.
You do have nasal and sinus congestion. Any fever?
No.
No fever at all, okay? Are you able to swallow or you cannot swallow?
Yeah, but it's a little difficult.
And what is the difficulty? Difficulty in swallowing or difficulty in pain?
It's a little bit of pain when I swallow, but it's like difficulty when I swallow. It's like I feel like something's stuck in there.
Something is stuck in there, okay?
Like
any difficulty in breathing?
I guess from my throat and nose being congested.
So you think your throat is swollen?
I don't know, it feels like I have a cold in my throat. I guess I need something like to get rid of the mucus in my nose and throat and my face and my airways, my lungs.
So there is some difficulty in breathing?
Well, I mean, I'm noticing I'm not breathing as I usually am because of the cold. So, yeah.
Any shortness of breath?
No.
No shortness, no lack of oxygen?
No.
Okay. Any chest or abdominal pain?
No.
Any nausea, vomiting, diarrhea?
No.
Any problem passing urine?
No.
Any skin rash?
Yeah, I've noticed I keep getting like these bumps on my head and on my face and
Bumps on your head and face, and that's how long that's been going on?
it's off and on, but it's like it's like right where my nasal passages is, like where the airways is on inside your face, like right above your nose, in between your eyebrows, underneath your eyes, kind of on the side of your nose, like where the air flows inside your face to your lungs when you breathe in through your nose. It's like the bumps.
This is on the face, not the bumps are not in the nose; they're outside on your face.
Yeah.
And you've been having off and on bumps for how long?
I don't know. They're off and on. It's been like that for a while now, but I'm noticing they're always around like where my airways are, like on my face. So there's something going on with my airways. Like I need some kind of medicine to clean all that out.
So the bumps on your face going off and on for some time. By some time means what? 1 year, 6 months, 1 month?
I guess a year or something, probably longer.
1 year. Okay. And have you seen any doctor for that bumps?
Well, yeah. When I went to the primary care physician, I told him, but they didn't really. They didn't really help me. I told them I needed to go to a ear, nose, and throat doctor, but they didn't help me.
They did not help you, okay. Now, you said you got a pain in the neck. And where in the neck is it hurting you?
In the back of my neck.
So if you look at your throat in the front, is the pain in the neck or in the back of your throat, which is sore throat? Or
the pain. No, the pain in the back of my neck. It's in the back part of my neck, not in the front part. It's in the back, like where the bone is.
And that's been going on for how long?
It's been like that for a while now.
How while, please?
It's been like that for more than a year.
And what have you done for that?
I've tried to go to the doctor, but they wouldn't help me.
They would not help you, okay? All right. Now, do you have high blood pressure, diabetes?
I don't think so.
Do Do you have asthma?
I don't know.
Okay. Do you smoke?
No.
No. And your COVID vaccination done? Not done?
No, I don't think I have COVID.
No. Did you have vaccination?
No.
COVID vaccination? No. Okay. So talking to you have some chronic back, neck pain going on for a year, bumps on your face and head going on off and on for 1 year. You do not know what makes it come and go, but you went to the primary doctor but did not tell you exactly what's going on with you. That am I right?
Yeah, the pain in my neck, in the back of my neck, has been like that for more than a year.
More than a year, okay. So the main problem today is that your throat is painful, nose is congested, and you have difficulty breathing and difficulty swallowing. Am I right?
Yes.
I don't know what's causing in your throat to make it difficult to breathe and swallow. It's tough for me on the phone to see what is going on the back of your throat to give you that kind of symptoms in less than a day. The best advice I can give to you is to go to the emergency room and let somebody look into your throat and in your nose and face to see what's going on.
Yeah, it's the problem. Whenever I go to the emergency room, they harass me. So that's why I called
Why
it.
you should harass you, sir?
Yeah, that's what they always do.
Why? It doesn't make sense.
Yeah, it'll make
They're not
sense.
supposed to harass. They're not supposed to harass any patient.
Yeah, but that's what they always do to me. That's why I don't go to the emergency room anymore. I just called MD Live to ask them.
I understand, but it's tough for me to say figure it out on the phone. This all started yesterday evening. In less than 24 hours, you got significant pain in your throat that makes it difficult to swallow and breathe.
Yeah, I noticed the people next door at the Airbnb, they were smoking outside my house, and whenever they smoke, the smoke, the smell, the smoke always enters like through the cracks of the windows and the doors and stuff, and I could smell it in the house. Usually when that happens, I notice my throat will get sore and I start feeling sick.
Cigarette smoking will give you irritations and all, but it cannot make you difficulty in breathing and swallowing and pain.
Well, it smelled like they were smoking weed and cigarettes also.
If you do not want to go to the emergency room, can you go to an urgent care and let them check it out? And then urgent care can decide whether to send you to the emergency room or not, depending on what they find.
Yeah, I'm not gonna go to the emergency room or urgent care. The emergency room.
You got significant, like, you got a significant problems. That's what you're telling me on the phone.
Yeah.
Less than 24 hours. You got less than 12 hours. If you sleep overnight, in next 24 hours, you will be in real trouble.
I think I'll survive. I just need some medications.
So medications for what, sir? I don't know what I'm feeding you because I don't know what's causing all this thing.
I guess something for a sore throat.
Sore throat infection doesn't give you this kind of symptom in less than 24 hours. I'm just going by what you're telling me on the phone, sir. So that's what I can advise you to do. Now, I cannot force you to go to the emergency room or urgent care, but that's only the advice I can give it to you, and then you decide. You know your body much better than me because I'm talking to you for the first time on the phone with no knowledge about you or any medical records about you.
Mm-hmm. Yeah, just.
So my advice would be to go to somebody who can look inside your throat, nose, listen to your chest to see what's going on, rather than taking a blind treatment.
Mm-hmm. Well, what could you prescribe?
Right,
yeah, I'm not gonna go to the emergency room, and I don't have money to pay for Uber to go to urgent care either. But what could you prescribe me for a sore throat?
I don't know what I'm treating, sir. What kind of treatment I give to you for your sore throat? I don't know what's causing it.
I don't know either, but it's like sore throat. And I'm noticing there's like some phlegm there when I'm like, when you like spit up a loogie, like the mucus. I guess something to get rid of.
You can take over-the-counter treatment for mucus. For mucus, you don't need a prescription. There are plenty of over-the-counter medication for mucus, for congestion. Mucinex D, Claritin D, Allegra D, Zyrtec D. These are all decongestants that take care of the mucus and congestion. You can buy without a prescription.
Yeah, I don't have any money. I'm on Medicaid.
I understand you. So that's the reason I think if you are there, let's get evaluated either in urgent care or ER.
Yeah, that's what I wasn't joking.
Okay.
I wasn't joking or exaggerating when I said I'm not gonna go to the emergency room, and I don't have money to go to the urgent care.
I understand you, sir. But urgent care may demand money from you, but the emergency room cannot demand by law. It's the federal law that says the emergency room patient has to be treated without any demand for money.
Yeah, the risk.
The federal law.
Right.
The federal law which doesn't, they have to treat any patient who goes to the emergency room without asking for any money. That's correct. So no emergency room can refuse your treatment.
Right, but the thing is, they harass me when I go there, and the risk.
So if you just be a little bit forceful, says, do not harass me. I'm here for treatment. If you just tell that simple sentence, not angrily or shouting like that, just tell me, doctor, please, I'm here for treatment and find out what's wrong with me. Please do not harass me. And that, their attitude will change immediately.
Yeah, the thing is, they don't care, because there was a nurse there who physically assaulted me, and I reported the nurse physically assaulting me. And when I exited the hospital and went to the waiting area, I called 911 after the nurse assaulted me, and I told 911 that the nurse assaulted me, and they trespassed me from the hospital because I reported the nurse assaulting me. And they
I don't know. When did that happen?
It was a few months ago. At the
So why this is not new months? There will be a new doctor, new nurse today.
Yeah, but the thing is, every time I go there, they do things like that. They harass me.
I see, but you have to be just if you will just politely tell them, please do not harass me. Because if you get angry, they'll get angry. So best thing is to politely, please don't. I'm here for my evaluation of my symptoms and see if you can treat me or not. That's it.
Yeah,
if you are polite and without any shouting, they cannot be shouting at you, cannot mistreat you at all.
Yeah, but then what they do is they try to fake and act like they're being polite, but they're harassing me, and they do it in a way where they could try to cover it up, and to where I can't prove it, to the point where it upsets me.
Mr. Best thing is to let's find out what's going on with you rather than discussing on the phone, because on the phone I cannot help you. Somebody has to look in your throat and examine you to see what's going on.
Yeah, but the thing is, like I said, I'm not going to go to the emergency room, and I can't afford to go to the urgent care. That's why I was hoping if you could just send me some medication.
I understand you, sir. But that is your choice. The only thing I can tell you, I'm talking to you on the phone for the first time with no records of you. And that's whatever, from talking to you, this is my medical advice. And then you decide what you want to do, man. So, okay?
So, I mean, what could you prescribe me for a cold?
Cold is a virus. For that, all you need is take plenty of water, warm salt water, gargling and decongestant, like Zyrtec D, Allegra D. But cold doesn't give you symptoms what you are describing me, sir.
I mean, what could you prescribe me that'll help?
There is no prescription for cold. It's all over-the-counter medication, sir.
Could you prescribe me like an antibiotic or something?
Antibiotic is for infection. I don't know what's going on in your throat to give you antibiotics, sir. In less than 24 hours, infection doesn't show up that bad.
You may have something else going on, or a severe allergic reaction to something going on that's closing your throat.
Well, could you prescribe me something for allergic reaction or something?
Sir, I do not know, sir, what is going on with you, sir. I don't know how many times I explained to you. Okay? I do not know what's going on with you, sir. Please, somebody just to examine you to find out exactly what's going on with you before they can appropriately treat you, sir.
What about something for the pain in my neck?
I do not know what's causing the pain, sir, again. You're taking it, suppose you've got a broken bone, I'm giving you pain medicine, I'm not curing your broken bone.
Yeah.
So first you have to find out what's causing the pain before somebody can decide what to treat with.
So there was, I was put in a chokehold, and then they twisted my neck to the right. They attempted to break my neck, and then they picked me up and they body slammed me.
If your neck is broken, that's a serious condition. Then you need to get a CAT scan of your neck done to see where the break is and get immediate treatment before you get paralyzed. If you think your neck is broken, then it's a serious condition. You should not be ignoring it all. Now, I do not know whether it's broken or not, but if you think your neck is broken, then you should be had an immediate CAT scan, not even X-ray. CAT scan of your neck bones done, and think it is a broken bone, then put you in a cast. Because a broken neck, if it's not treated, you get paralyzed permanently. It affects your spinal cord.
Yeah, that's one of the main reasons why they keep harassing me, because of the...
I understand you, Mr. Falk. All I can do is I'm sorry for that they're doing that, but I think we should become polite. They will be polite to you. Let's get evaluated done to see what's going on, and we go from there, okay?
Yeah, I'm always polite to them. That's not an excuse for them to assault me and harass me.
Just go and peacefully find out exactly what's going on with you, sir, okay?
Yeah, the thing is, we're in America. This is not a third world country to where it's a dictatorship.
I understand you. You should not be treated, I agree with you wholeheartedly, you should not be treated that way at all. Yeah. As a patient, you have a right to be treated appropriately and with respect.
Right, and the thing is, they're aware of the people who tried to break my neck, and because of that, they keep harassing me. And they're trying to act like I did something wrong to them, because the people who tried to break my neck are the police in South Florida.
Okay.
And I'm in Tallahassee, Florida now for my safety because of the harassment ever since I reported them injuring me. And now every time I go to the emergency room in Tallahassee, they're harassing me because I'm telling them that my neck is injured and it's because of the police injuring me. And they keep trying to harass me and trying to make it seem like I did something wrong so they don't have to help me and so the police don't get in trouble.
If you are in Tallahassee, I don't know where, but you said if you are in Tallahassee, there are more than one hospital. There are at least 4 or 5 big hospitals in Tallahassee.
And every single one of them...
You can go to a different emergency room.
Yeah, I know, but that's the thing. I went to all of them because of the harassment. And Tallahassee Memorial Hospital, when I reported the nurse there that physically assaulted me when I was there recently, they trespassed me.
I understand you, Mr. Forbes. You discussed this quite a lot. On the phone, I cannot help you. So I leave it up to you to decide what you exactly want to do. So my advice will be to go to an emergency room and get evaluated to be done. All right, sir? Thanks a lot. Okay?
Yeah, well, the thing is, I'm not going to be able to go to the emergency room. So I was saying, can you just send me something for the pain at least?
No, sir, I cannot treat you blindly for the pain that I do not know what's causing the pain, please.
It's in my records.
I'll be politely trying to make you understand that you need to be evaluated to see what is going on rather than blind treatment.
What I'm trying to say is, it's in my chart that I have neck injuries. They prescribe me.
I understand you, sir. I do not deny you that is there, but I do not have access to your medical records. So my advice will be, please go to the emergency room to find out what's going on with you.
Yeah, I'm not going to go to the emergency room. They keep harassing me.
That is your choice, sir. But that is your choice. I cannot force something like you. That is your decision and your choice. You know your body better than anybody else. So you decide exactly what you want to do, okay? So I'm going to move on to another patient. So I'm going to end the phone conversation now and